Diana Berrent has agreed to share her story with us. She joins us now live from Port Washington in New York to tell us more about her experience. Diana, really appreciate you being with us. Tell us about your aha moment where, after being one of the first cases at a New York hospital, you said, right, I can do something about this.
Well, so I was one of the first people in my area to get a positive COVID-19 diagnosis, which came as quite a shock because I'm 45, I'm healthy, I exercise, I'm super adventurous, I don't get sick. I was the first one of the first people in my county to get diagnosed. And when I got that diagnosis, I realized that if things went well, I would also be one of the first survivors. And with that came a tremendous responsibility, but also an opportunity. And at the same time, I started to see messages being passed around looking for survivors, almost sent like chain mail. And I realized immediately that the antibodies that I was building up in my system that was able to fight off this virus, I could donate to others and use that sort of superpower to help save other people's lives. We had to create a more efficient system, a better platform to connect survivors with the researchers so that they can do the work and stem the tide of this pandemic.
That's incredible. What has Survivor Corps been able to do so far?
So we launched it's an open group on Facebook. Anyone can join because we are all affected, and we have members from around the globe, a global community right now, and we have to respond as a global community. Within hours of launching the group last week, within hours, there were matches already being made between survivors and researchers. And now, within a week, we're at 17,000 members. And we are actively seeking out every research study that's going on in the United States and keeping an active list on that site, on that page, so that survivors have a place to go and find out where they can volunteer, because people want to help. People want to volunteer, and we need to make that system more efficient. So we're acting as almost a matchmaker because we don't have time to waste. There are people dying left and right, and we are in the unique position that we have antibodies, we have superpowers that can help save other people's lives. Other people whose bodies didn't respond to the virus with the creation of their own antibodies.
And what is the ultimate goal for you? Where do you see Survivor Corps going from here?
So we have several sort of long-term goals with it. In the immediacy, we're building out a real opt-in database, so a real infrastructure that will go beyond this current it is currently a grassroots movement, and it is incredibly powerful, but we are building an infrastructure behind it so that it can be an opt-in database that researchers have real-time access to contact volunteer survivors and use them as volunteers. But in the long term, once the suspicions of immunity are confirmed, there's no reason that survivors can't use those same superpowers to go volunteer in hospitals without needing protective gear. We can hold the hands of the dying who are there alone without their loved ones. We can cheer on women in labor who are having to go through childbirth without their partners. And more importantly, not most importantly, but importantly as well, we can go back to work. So right now we are being offered a binary choice of either saving the economy or saving lives. And Survivor Corps, as the epicenter of hope, can offer an off-ramp to that terrible, horrible choice. So once you prove that you no longer have the virus in your system and your blood shows the antibodies, there's no reason that those people can't go back to work. And we can restart the economy, maybe a little bit more slowly than we would ideally like, but we can do it at the same time while we're still sheltering at home the most vulnerable in our community.
Diana, one thing that you mentioned in your video diary was we all need to pretend like we are infected, that we have the coronavirus, and treat every human being like they're a loved one that we care about, so we can stop the spread of COVID-19. We really appreciate you sharing your story with us. Diana Berrent, thanks for that.
Thank you.